Your heart beating out of rhythm can be dangerous and even deadly.
Well, that's certainly alarming. Dr. Kofi Asai from St. Mary's Regional Heart Institute is here to talk about diagnosing and treating heart rhythm problems. And first of all, thank you for coming in.
Yes.
You're welcome.
And discuss the difference because it is totally different than other heart problems, isn't it?
That's correct, yeah.
Yes.
Talk about the difference that people would notice.
Right. So typically, if you think about the heart, we have what we call the electrical system of the heart. Just think about your house having like an electrical wiring system and also a plumbing system. Most people are more familiar with the plumbers of the heart than the electricians of the heart. So we, as electrophysiologists, are the electricians of the heart. And the reason why heart rhythm issues are important is that the rhythm of your heart determines how well your heart pumps.
Okay.
And so when your heart goes out of sync, your heart doesn't pump blood efficiently to your brain and to other organs of your body. Yes.
So that is dangerous.
That can be dangerous, exactly. And what typically happens, because you don't get blood flow to the brain, people come in with like faintness, lightheadedness. If your heart is beating very fast, especially when you're not exercising or doing any sort of activity.
Just resting heart rate.
Yep, going about 150, 160, 190 per beat. You feel palpitations.
I see.
And sometimes, heart rhythm problems, especially atrial fibrillation, can be dangerous because it can cause strokes. And that's a very important thing I would like folks to know.
Right. How is this diagnosed and then treated? We're looking on the screen. We see some of the symptoms there, but how do you diagnose this in someone?
Right. So diagnosing diagnosing heart rhythm problems basically starts with what we call an electrocardiogram.
Okay.
And this you can get in any doctor's office routinely. From that tracing, we can derive a lot of information about the electrical activity of the heart.
Okay.
But we have several advanced diagnostic modalities as well. Sometimes we can have patients wear monitors at home for an extended period of time.
Okay.
And in addition to that, we can do what we call electrophysiology studies, where we bring patients to the lab, and we thread very tiny catheters into the heart to try and pinpoint where the problem is coming from.
And then one of the treatments I would think we always hear about a pacemaker, as that's one of the things, try to get things back in rhythm.
That's correct. And when most people think about electrophysiologists, they think about pacemakers, but we do a whole lot more in terms of treatment modalities. Yes, that's correct. So we also, recommend medications and lifestyle changes, and these are very important. Also, we do what we call advanced, procedures like catheter ablations. And again, the similar principle, threading the catheter into the heart and finding the trouble or the problem spots and zapping them, to get rid of the problem. So we do quite a lot of treatment modalities in the specialty of electrophysiology.
If people want to avoid this problem in the first place, is there anything they can do, or is this something that is genetic, purely, or smoking, obesity, or do those have a play in this aspect of heart problems?
And that's a very good question, because the first thing is prevention. And definitely lifestyle have consequences for your heart rhythm, especially when we talk about atrial fibrillation. And that's the #1 heart rhythm problem, in the country at the moment. So things like obesity, smoking, alcohol, sleep apnea, untreated hypertension, uncontrolled diabetes, all these are risk factors for atrial fibrillation. And we know targeting all these risk factors as part of the treatment of atrial fibrillation tends to bring down the burden of atrial fibrillation. So those are very important, and I always educate my patients on these factors when they see me in the clinic.
Yeah, some of them, a lot of those seem very simple lifestyle changes to make. If we want more information, or maybe even come in for some of the testing and find out more about treatment options, we've got the phone number on the screen there right now for Marshall Health Network to address heart rhythm disorders.
Give them a call before it's too late. That's the thing about this is you want to be checked out because, like you say, prevention is everything. Getting to a doctor early. So, Dr. Asai, thank you so much for coming in.
Appreciate it. Thank you for having me.
Oh, you bet.